Të dashur miq, tema që dua të trajtoj në intervistën e sotme është zbatimi I etikës së krishterë në çështjet e homoseksualitetit, abortit dhe eutanazisë. Bashkëbiseduesi im quhet Scott Ray. Ai ka kryer studimet universitare në Universitetin Metodist të Jugut, ka master në teologji nga Seminari Teologjik I Dallasit dhe doktoratur në filozofi nga Universiteti I Kalifornisë së Jugut. Dr. Ray ka shkruar 10 libra mbi etikën. Puna e tij kërkimore është botuar edhe në disa revista shkencore si Feja dhe Liria, Revista e Tregjeve dhe Moralitetit, Etika dhe Mjekësia e të tjera. Le të ndjekim intervistën që kam zhvilluar me ta. Dr. Ray, I really appreciate for making time to have this conversation together.
Well, my pleasure, brother. Thank you. Thanks for having me on.
I was introduced to your name by reading your book Moral Choices last year. I have not read many books like this that present the strongest arguments even for the side that you oppose.
I appreciate that. I tried hard to be fair because just setting up straw men doesn't help anybody.
Yeah. It really shows an integrity of the kind of scholarship you do. Well, the reason I make this comment about the book is not just to compliment you, but also because I'm basing my conversation today on this book. And
well, I appreciate the free publicity for it too.
But there are 3 ethical issues for which I would like your inputs for our viewers in Albania. And these topics are homosexuality, abortion, and euthanasia. I would like to start with some questions concerning homosexuality. In your book, after you define the term homosexual, you list some myths that people believe about homosexuality. Could you briefly mention some of them here?
Yeah, I think there are several. Well, I think probably the most common one is that homosexuals have some sort of behavioral things that identify them, like being effeminate or, traits like that. That's not true. I mean, we've had gay people come out in the National Football League and, in other places where you might not expect them. So that stereotype, I think, that's a hard one to maintain. The other myth, I think, is that a homosexual orientation is something that you were born with in terms of being hereditary. And at present, there's not a lick of evidence to suggest that there's any genetic connection to a same-sex sexual attraction or orientation. That doesn't mean that homosexuality is chosen. I think for most, their sexual attraction is something that they discover, as opposed to deliberately choosing it. Now they can choose to nurture it. That's different. But I think generally it's something that occurs developmentally as a person grows up. But and I understand what people mean when they say they've never experienced anything else but that. But we have a lot of traits that we all have in our lives that we have never known anything different than those traits. But it doesn't mean that we were born with them or in a sense that it has a genetic connection.
Yeah, can you elaborate some more on the factors that lead to homosexuality?
Well, it's really hard it's really hard to generalize on those. But some of the things that seem to be in common are a couple. Usually, it's not uncommon that there's either an absent or an attached and angry father in the person's life. And another trait they typically, I know there are exceptions to this, of course, but another trait they tend to have in common is that the rituals that we have in many cultures of boys becoming men or girls becoming women are not often experienced well. So that can have an impact as well. And it may be that, it's not uncommon for people to do, a fair amount of sexual experimenting when they're in adolescence. And if some of that sexual experimenting happens with someone of the same sex and is a good experience, that often is a factor that's in common too. I wouldn't want your listeners to be misled though. It is really hard to generalize And we want to make sure that just because there are correlations or things that are in common, that doesn't necessarily mean that those are the causes. Mm-hmm. So correlation and causation are not the same thing.
In your book, you make a distinction between homoerotic and homosexual. What is this difference and why this is important?
Well, this actually, I think, is a really important distinction to make between, I'd maybe put it, I think it's in the fourth edition, I'd make it a little clearer. There's the distinction between the attraction and the behavior. Since the attraction generally is not a choice, not someone consciously chooses, it's harder to say that they're morally culpable for the attraction. What the Bible seems to be most interested in is the behavior, not so much the attraction. So I would say that the attraction itself is for the most part not something that people are held morally responsible for, even though it's clear from Scripture that the same-sex attraction is not the way God originally designed it. Mm-hmm. So there's something as a result of the fall that got someone's sexual wires crossed. Mm-hmm. But it's the behavior, particularly the lust, which I would suggest that Jesus defines lust as mental sexual activity where you're the star of the show. And then any further acting out on that sexually would also be problematic.
So it seems like you're saying that a person can have those drives, some sexual emotions, but if he or she will restrain those, that will not necessarily be a sexual behavior.
That's right. I think it's entirely possible for someone to have a same-sex attraction, be committed to celibacy, and walk faithfully with the Lord.
Now, you mentioned a little bit so far, but what do you think will be a biblical response to homosexuality?
I think first, we need to have a heightened compassion for those who are wrestling with their sexual orientation. This would include folks who wrestle with a transgender, orientation as well. And I think we need to be clear about what the Bible teaches about the behavior. But I think for lots of people, lots of gay people, who want to take Christian faith seriously, they don't feel like they have the option to do that. And that's, I think, a huge problem, because our churches need to be more welcoming places for folks who would say they are gay, but are committed to being faithful to Scripture, mm-hmm. and committed to celibacy. Mm-hmm. And I think our churches need to be a place where, single adults, unmarried adults can form the kind of really rich friendships and intimate attachments that they need. It's possible, so people can live without sex, but they can't live without love and intimacy. And for those that say that you have to have sex to be a fulfilled human being, I think the model of Jesus suggests something different than that. I think for a Christian to say that I can't have a flourishing life without sex is really hard position to maintain in view of the example of Jesus.
Yeah, I appreciate the way you put it. People can live without sex, but they cannot live without affection and love. So that's a great insight.
And our churches need to be at places where they have opportunities to pursue those.
I think you also develop in your book also arguments that go against homosexuality that come outside of the Bible. Could you mention some of them?
Yeah, I think historically, this is in the big picture historically, but when the more traditional family with a husband and a wife who are married to each other, living under the same roof, raising children, regardless of how extended the family gets in some cultures. And I think it was rather extended like that in biblical times too. But the basic family unit of a husband and wife who are mother and father to the children living together under the same roof. Whenever that has been, what's the best term? Whenever that has been under assault, it's not gone well culturally. I think, you think back to the fall of the Roman Empire. I think you can look at some of the things going on in our day, since the 1960s in the United States and in Europe, where the family has been under assault. And I think that, for the LGBT movement to succeed, they have to downplay and undercut the traditional family model. And that's, I think, had disastrous consequences in Europe and throughout the West, at least in the last 40 or 50 years. So I think that would be one. I think I would also see, I think there's a natural law argument that suggests that God designed male and female to fit together sexually, not same sex, given the propensity of bad outcomes that have happened medically over the years. So I think there's probably a public health thing that you could suggest. There are things to think about even outside of what the Bible teaches. Yeah, no, I think there's a point to be made about marriage being intrinsically ordered toward procreation. That's not the only good of marriage. It is one that's intrinsic to it. So that's why, I think you can make an argument that, regardless of, you can call same-sex relationships whatever you want. And if the government wants to legalize them, then so be it. But just don't call it marriage. Yeah. Because a same-sex relationship cannot be intrinsically ordered toward procreation.
I'd like to give your permission if I can ask you some question on the issue of abortion now.
Sure, let's get to the easy part.
Yeah. Do you think that the debate on abortion today, framed as a pro-choice versus pro-life, is the proper way to discuss this topic?
Well, not entirely. I think that, the pro-life supporters, I think, are right to say that they are pro-life. I think that's true. And I'd say that for the pro-choice label, I think can be a little bit misleading because, I'm pro-choice about a lot of things. Depending on what you're choosing. So it's, I'm in favor of the right to choose is an incomplete sentence. The right to choose what is, you have to complete that in order for somebody to offer an opinion about that. So, people who are pro-life are often made out to be anti-choice, when we're really in favor of autonomy for a whole lot of things. It's just, I don't favor a woman having a choice to end the life of her offspring. And if that's, that's the choice. So it just depends. Say you're pro-choice depends on what you choose.
It seems that one of the issues that is being debated time after time is the question, when is the moment that the fetus becomes a human being? And as you know, many alternative views are offered, such as the moment of viability, for instance, or the brain activity, or when the unborn starts quickening, or when implantation happens. And there are also others who say that the unborn becomes a human being only at birth. So according to your research, what do you think is the decisive moment?
I think there's only one place where you can assign human personhood that's not arbitrary, and that's at conception. because implantation is just a change of location. Same for birth. Viability says nothing about the nature of the unborn child. Viability is a commentary on medical technology. Quickening is just when the woman feels the baby moving around, which requires motion and things like that. But we all know that a woman is pregnant long before she first feels the movement of the baby. So there's really no place other than conception that I think makes any sense. Because at conception, that unborn child has all the capacities that they will ever have. It's just what and I think it's the way we talk about this matters, because I would not say that embryos develop into fetuses or embryos become fetuses. The better way to say that is that embryos mature into fetuses, which mature into newborns, mature into toddlers. Mm-hmm. So they're maturing according to what they already are from the very start.
If I'm not wrong, you started as a biblical scholar and then went to ethics and still involves the biblical studies in it. But I want to ask you, does the Bible speak about abortion? Have the biblical writers commented on this topic?
Indirectly, yes. No place in the scripture says thou shalt not have an abortion. Mm. But the biblical teaching is very clear that from the early stages of pregnancy, you have a full person, image of God bearing unborn child. Psalm 139, for example, is, I think, the best example on this, where David affirms that even when he, as a person, was in his mother's womb in an unformed state, which because they didn't have ultrasound technology, that's the only way the biblical writers knew how to talk about it, was in that early state before the unborn child came to resemble anything looking like a human being. It was still a person with whom God had a relationship and a plan. You see this bearing out as well in the early chapters of Luke, in the infancy narratives of Jesus, where Mary discovers that she is pregnant immediately after becoming impregnated, which is kind of unusual. That most women don't find out until about 6 weeks to 2 months after conception's occurred, and then when she's maybe 5 days, a week pregnant, she goes to visit her sister-in-law Elizabeth and announces that she's pregnant, and the celebration that ensues is such that the Messiah has come. There was another celebration when Jesus was born, but it's really clear that from a week at pregnancy, the person she was carrying was a full image of God bearing person. So, the biblical writers didn't address the notion of embryos outside the womb because there was no such possibility. So I think it's unrealistic to expect the Bible to speak to any of that. But I think where they do speak to it, they are pretty clear and unreserved that from the very early points of pregnancy, you have a full person.
I mean, you know very well that pregnancy can happen in some very unfortunate ways. For example, do you still oppose abortion even in the case of a pregnancy resulting from rape?
If somebody asked me, is it morally right or morally acceptable to compound one act of violence with another, I would say no. What I would encourage a woman to do who's been sexually assaulted and ends up pregnant, which is incredibly rare, by the way. Mm-hmm. One in probably 100,000 cases does that happen. But I would encourage her to keep the baby for the 9 months and put the baby up for adoption, as opposed to, ending the life of an unborn child through no fault of the child. Now, if she chose to do that, I would understand. I probably wouldn't give her a lot of grief about it. But I think for moral purposes, to say that that's morally acceptable, I think is a stretch, because I'd want to suggest that the means by which someone is conceived doesn't have anything to do with what kind of a thing they are. Whether the unborn child's a person or not has nothing to do with the circumstances under which his or her conception took place.
It seems that it involves like an emotional decision and a moral act that's not based on the baby or on the unborn, but based on something previous.
That's right. Yeah. That's right. And I understand why people take that into account. I would not say that's a decisive factor.
The abortion debate also involves discussion about reproductive technologies, and you also write this in your book. So what are some general principles that a couple should consider to avoid the dilemma of abortion when thinking of using those technology for reproduction?
Well, if it's true that embryos are people too, which they are, then any reproductive technology that where embryos are discarded, which is commonly the case in in vitro fertilization, or where selective termination is performed, which is becoming less common today, because physicians, I think, have a better sense that they shouldn't be implanting these multiple embryos. So I think we don't see as much of that selective termination today, which I think is a good thing. But I think with IVF, that is still clearly the case, that there are lots of, there are probably 500,000 frozen embryos in the United States today. I don't know about Albania. It's pretty clear, I think, that in order to maximize the success of IVF, you create as many embryos as you can. Get pregnant on the first try. If embryos left over, typically they just get discarded. And so couples should they should resolve, Christian couples should resolve, not to throw away embryos. They can either implant them themselves, or they can give them up for embryo adoption, which in lots of parts of the world is a live option. I'm not so sure about what the situation in Albania would be on that. But they should also limit the number of embryos that are implanted to the number that the woman can safely carry, and the number of children that they actually are willing to raise. So if she's really small and can't carry triplets, you shouldn't implant 3.
Giving the embryos for adoption compared to the option of killing the embryo, giving the embryo for adoption in itself, does it involve any ethical dilemma there?
Well, it's not ideal. The ideal is for the 2 parents whose genes generate the child, that there be continuity between procreation and parenting. I wouldn't necessarily call all breaks of that continuity unethical, because, there are lots of times that, families just are not able to provide adequate care for a child for a variety of reasons. And I think in this case, this is, the parents obviously are not unfit, but what they've determined is that those children would be better off for a childless couple than with them. Now, whether that's true or not, it's hard to make a blanket statement about that. What I would be nervous about is if I were putting those embryos up for adoption to a non-believing family, for example, or a single woman who is going to raise those kids by herself without a dad. I think those situations, that becomes very problematic.
Dr. Ray, I would like to spend our remaining few minutes talking about euthanasia and the physical assisted suicide. Would you please explain what these terms mean and what is the difference between them?
Euthanasia simply means, it's the umbrella term. It's from two Greek words which mean good death. And I would actually distinguish between, there's three different things I would distinguish. One is the termination of life support, which in many cases is completely ethical to do, where in essence you are allowing disease to take its natural course, absent any further medical interventions. Physician-assisted suicide is where the patient enlists the assistance of a doctor to take his or her own life. The physician prescribes, instructs, and supervises the patient when he or she ingests the medicine himself or herself. Euthanasia generally occurs when the patient's too sick or debilitated to take his or her own life himself or herself. And so the physician actually administers the lethal dose of medication. Case of euthanasia. In the U.S. and I think most of Europe, euthanasia is still illegal. Physician-assisted suicide is legal in a handful of states in the U.S. and places like Belgium, the Netherlands, parts of Scandinavia. Not sure. I'm not sure. I don't think it's legal in most parts of Eastern Europe.
Yeah, that's right.
But whether that is preventing people from practicing or not is another question. Because in the Netherlands, for example, it was widely practiced for many years before the law was formally changed. And in today, parts of Europe, we're seeing, children as young as 12, given the option of euthanasia to make that choice for themselves. Newborns, seriously ill newborns are being euthanized much more regularly. And the discussion in Europe is being more explicit about the economic costs of taking care of people at the end of life. It's sort of under the adage that there's nothing cheaper than dead. Considering euthanasia as legalizing it as part of the answer to holding down the costs for this increasing numbers of elderly we're going to have in the next 20 years or so. Lots of places in the U.S. where it's still illegal. It became legal in Australia not that long ago. But there's still, I think, a significant debate about it in lots of parts of the world. Western Europe, probably it's become a much more accepted thing.
So between those three, termination of life support, you said, and then euthanasia and physical assisted suicide, only the termination of life support will be argued to have a Christian ethic, but it will be analyzed case by case, as you seems to say. Yeah.
under the right conditions. I mean, if you God forbid, if you had a heart attack while we're speaking here, I wouldn't, I would never say, well, let's just, withhold life support and allow, the disease to take its natural course. Because your prognosis would be excellent, and of course we should intervene. Where I think it's acceptable is where further treatment is futile, or whether it's more burdensome than beneficial. And in many cases, people at the end of life where they are seriously ill, they are sustained on treatments that they actually don't want, but that their family members continue to authorize because their family members, understandably, don't want to let go of them.
Yeah.
And so that puts the patient, I think, in a not a very good place. Yeah. Because they're lingering on in a state that they don't want. They'd rather go home and be with the Lord. And essentially, hospitals are providing medical treatments for the family's benefit, not the patient's. And that I think is almost always unethical to do that.
You also say that on this particular issue, you seem to say that the Christian must have the biblical view of death to properly understand this issue. Could you explain what's a biblical view of death?
Yeah, there's two parts to it. Death is not what God originally designed, but as a result of the cross and resurrection of Jesus, death is a conquered enemy, and therefore it need not always be resisted. It can never be directly caused in physician-assisted suicide and euthanasia, but it need not always be resisted if treatments are futile or more burdensome than beneficial. I don't want us to be in a theological position of saying that earthly life is the highest good, which it's not. And if we say that we're obligated to keep people alive at all times, all costs, no matter what, we're essentially affirming that earthly life is the highest good.
Well, we would say that there is an eternal life that's the highest.
Right. Our eternal fellowship with God is our highest good. Now, earthly life matters a lot. It's important, but it's not the very highest thing. So, again, under the right conditions, it's okay to say stop the medicine. And in essence, we are turning that person back over to the Lord when we make that decision to stop treatments.
So, in that sense, that could be a good death. Would you argue for that?
Yes, that would be the goal. It doesn't always happen that way, but that's certainly the intent. And so to have people in hospice care, for example, or in a place where the only treatment they receive is to alleviate their pain, that can be a moral option.
Let's conclude with one last question. When ethicists discuss the topics of euthanasia and abortion, a principle that is repeatedly brought up is the sanctity of life. What do the ethicists mean by this principle, and how does it influence the way these issues are solved?
Yeah, that's a great question, because the sanctity of life has been interpreted in a lot of different ways. What I mean by that is that human life has an intrinsic value simply because we are members of the human species. We have as a result, we have the right to life, and we have rights over our own bodies to make decisions about what happens to us. But most of it revolves around having the right to life. And therefore, anything that directly causes the death of another innocent person is morally wrong. So it would involve the idea that human beings have an essential, intrinsic dignity to them by virtue of being made in the image of God, regardless of our ability to function.
Thank you so much, Dr. Ray. It has been a great pleasure to talk to you today.
And great to be with you. And to all your listeners in Albania, all God's best to you.